Go, sir. Go.
Good morning
to live. You can start.
Good morning to one and all. Welcome to the international web series organized by JSS College of Physiotherapy on occasion of World Physiotherapy Day and 105th birth centenary celebration of Magaswamiji. And today is the 6th day. And today's topic is return to sports in overhead athletes, presented by our Mr. Prabu Raj. He is assistant professor, senior scale, working in Manipal Academy of Higher Education, and he is a center coordinator for Interdisciplinary Center for Craniofacial and Orofacial Pain Research, and currently he is pursuing his PhD. And he did his MPD from Father Muller Medical College, Father Muller Physiotherapy College, and BPD from Sri Ramachandra Medical University. And he published various research articles in index journals, and he conducted many workshops in sports physiotherapy. And over to you, sir.
Okay, sir. Thank you very much, sir, for your kind introduction. Thank you, JSS and Kavita ma'am, for giving me this opportunity. It's indeed my pleasure. Okay, so good morning, everyone. Let's start with the topic directly. So our topic is return to sport in overhead athletes. So we know that there are so many athletes who involve in overhead sport. So overhead athletes are the one who involved in sport like us, where a lot of rotation related activities are involved, like tennis or throwing, pitching in baseball, or for example, even throwing in cricket from the boundary line, or even in volleyball spike, badminton smash. So everything involves overhead sport. Even in swimming, everything involves overhead activity of the shoulder, which puts a lot of strain on the shoulder and leading to so many injuries and other issues in terms of shoulder. So they wouldn't be able to get back into sports easily once they had some issues. So look at this picture, see the volleyball spike. Imagine the amount of loading which is imparted to the shoulder. So let's see one of the overhead sport, Sam Groth. He is having one of the fastest service in tennis. So now if we check this, let's see how much amount of force he exerts in order to exert a force on the implement, the tennis ball. So now if you see, so this is the first phase where he starts from the movement initiation and then where he reaches the maximum external rotation of the shoulder. So this is the first phase. So from the movement till the maximum external rotation. So from here till here. This is the phase 1, which is important, till here, till he reaches maximum external rotation. So, okay, from here till here, the phase 1 stops here. Okay, and the second phase is from maximum external rotation till the ball impact. That's the acceleration phase where he accelerates. From here, maximum external rotation, where the racket is towards the ground, from that position till he impacts the ball. That's the second phase. And the third phase is after the ball impact, the deceleration phase, and how he decelerates whatever potential energy he has created. Whatever energy he has created, it has to be dissipated properly. So let's have a look at it again. So this is a 3-phase model. Actually, we can consider in terms of 8-phase model too, but to make it simple, I made it a 3-phase model. So from the movement initiation till the maximum external rotation, phase 1. From there, phase 2, where from maximum external rotation of the shoulder till the ball impact, and then the phase 3, it is the deceleration phase. So if you see here, in the 3 phases, the first one is the preparation phase. If you see here, there is not only the shoulder movement which is involved, isn't it? So look at that. He actually dip with the knee flexion. A lot of trunk movements and pelvic movements are happening here, and shoulder movements are happening here. So he is dipping and then he drives. That means he tried to exert a force and then try to deliver through the entire kinetic chain system. So it is not only the shoulder which is working, isn't it? And even the acceleration phase. So whatever energy he created here, okay, to the dip and drive, from here he actually accelerates. And acceleration again doesn't involve only the shoulder. Acceleration involves the movement of pelvis, the movement of the trunk. Look at that movement, not only the movement of the shoulder, it is the movement of the trunk, movement of the lower limb. He is off the ground. And then finally the follow through, whatever force he has generated in the preparation phase and the acceleration phase, he tries to observe the force. So for these phases to happen, it is not only the shoulder which is working, it involves multiple joints which works and multiple muscles where there is a coordinated sequential movements of the entire human movement system to work in order to deliver one tennis serve. So that is in terms of tennis. Now look at this in terms of badminton smash. So look at the amount of trunk rotation and look at the amount of shoulder rotation and how he exactly exerts his force from the lower limb. He jumps off the ground. He puts a lot of stress on the ground and in turn ground exerts an equal and opposite force. And look at the amount of the speed what he creates into the shuttle badminton court. So here it is almost 426 km/h. So in this speed, in this velocity, shoulder produces actually only 13% of the kinetic energy during the badminton smash. Not only in badminton smash, in tennis or whatever overhead sport we play, the shoulder, which we think it is the most important joint to accelerate, to create a maximum velocity of the ball or of the implement, whether it is a even javelin throw or a shot put, actual kinetic energy, especially in terms of badminton smash, if we take only 13% of the kinetic energy is produced from the shoulder. So the remaining what? Remaining 87%, where does it come from? There are a few studies which says that in tennis, leg and trunk generate almost 50 to 55% of the total kinetic energy required for the serve. So if you want to serve properly, you have to generate almost 50% of your total kinetic energy from the lower limb. Whereas in baseball pitch, if you see, lumbopelvic hip stability and gluteal muscle activation are very important for efficient pitching. And other study says that in over throwing athletes, reduced hip abductor strength and hip range of motion may be associated with the increased risk of shoulder and elbow injury in athletes. So all these studies, they don't consider shoulder as an isolated joint and the shoulder musculature as an isolated muscles. Rather than that, they consider every overhead sport movement as the entire human movement system. So there are various risk factors we consider, and we try to focus on various risk factors in order to prevent shoulder injuries in overhead sport. A recent systematic review has suggested few. So the first and foremost, what we usually see is glenohumeral internal rotation deficit, the restriction of internal rotation range of motion. For example, if I can show you my example only. For example, all people will have issues, all athletes will have issues, because there are some studies which says that there is something called as clinically significant GARD, glenohumeral internal rotation deficit. So only when it is clinical significant, that means when the difference in the range of motion of the left and the right side is more than 30 degrees, and if you are not compensating, for example, if you see mine, so I have a restricted internal rotation on my shoulder, isn't it? So now if you take my left side external rotation, this much. So I have this much of external rotation on the left side, whereas my right side external rotation, look at that. So even though I have a restricted internal rotation, I have a compensatory excessive external rotation. So most of the time, most of the athletes will have such compensation. So what they say is whenever there is a compensation, you are less prone for shoulder injuries. And so there is something called as 180-degree rule. So even though if you have a restricted internal rotation deficit, like myself, okay, and if there is a compensation with the external rotation, you achieve almost 180 degrees, right? In such cases, you're not that clinically, more prone for shoulder injuries. So that is also considered as one of the risk factors. So restricted internal rotation range of motion and decreased or compensatory, or if you have a 180 degree, if you have 180 degree, no problem. So less than 180 degree of internal external rotation, then you are more prone for it. There are studies which says that excessive retroversion. For example, we have an excessive humeral retroversion in terms of when we were a child in the childhood stage. So our retrotorsion of the humerus is almost 40 degrees. So what happens when you start training, especially pitchers? There is something called as little leagues shoulder and little leagues elbow in people who involve in overhead sport in their very early childhood stage. Okay, so what happens is they have a already excessive retroversion of the humerus, which actually reduces as you grow. But what happens when you involve in high-end overhead sport activities, when you involve in so much of overhead activities when you were during the childhood stage? So they say that there is the retroversion, the increased retroversion remains the same and doesn't decrease. So in such cases, again, you are more prone for injury. So the earlier you play and you overload too much because of the compensatory changes in the excessive retroversion of the humerus, you are more prone for injury. So there is one more risk factor that can be associated. Then there are other risk factors like flexion deficit can be associated. Total range of motion, as I said, 180 degree if you don't have, then you are more prone for it. There are so many studies which says like that, but what the evidence is, everything is almost limited.
Audible, sir? Prabu, sir?
Retroversion of the humerus when you start playing at the very early childhood stage. So again, that is limited. So a review says that even though we consider so many risk factors, still now studies are showing very limited evidence for all these risk factors in terms of shoulder injury. So what could be the other reason? As I said in badminton smash, only 13% of the force is coming from the shoulder, isn't it? So the remaining 87%, where does it come from? So it should, as we have seen in the tennis serve analysis also, Sam Groth can efficiently produce that much of angular velocity of the shoulder in order to impart that force to the ball. It's because he used the entire human movement system in a proper sequence, and he has all the mobility and stability issues. So he is able to deliver that. So what is the main factor? What is the core which is actually helpful in transferring this efficient force which is generated from the lower limb to the shoulder? Probably the center between the lower limb and the upper limb. It is the core, the center core. So there are certain requisites for the core to actively work properly, isn't it? So the requisites are how much range of motion you have at the trunk and how much you're able to actively exert force or transmit force through that. So one such factor which is important is called as the X factor. That means how much you're able to separate the trunk, as it is given here, from the shoulder and the hip axis, and how you're able to change the position of the shoulder with respect to the trunk. Okay, how much angle do you reach? How much range do you get it? So that is called as X factor. So X factor is checked like this. So you draw a line. For example, you have to take a 3D video, or you have to take a video in a vertical axis, and then you can draw a line on the hip axis, and then you can draw a line on the shoulder axis. Okay, So between the shoulders you connect a line, and between the hips you connect a line at the end of the preparatory phase. Okay, so this is the end of the preparatory phase in a golf swing. So the end of the preparatory phase, you have to check how much angle he is able to how much angle range he achieves between the hip and the shoulder. So that shows X factor. So for example, X factor angle here, in this it is almost 54 degrees, whereas here it is 70 degrees angle. So if you are able to create an excessive angle here, that means you are able to stretch your oblique muscles properly. So it is like a kind of a stretch shortening cycle. You stretch it and then you deliver a force. Okay, so for example, if you take this is the study where they have checked the influence of trunk rotation, basically the X factor, and on the quality of badminton forehand smash. So if you see that X factor here, especially in the spike of a badminton smash, look at the amount of X factor here. Okay, so that means there is an excessive trunk rotation which is happening, making the X factor to be maximum as much as possible. So X factor is quite a lot here. Okay. Now compare the X factor between the novice group and the elite group, who are quite experienced. Okay, so if you see the X factor, that means how much range they can achieve in terms of trunk rotation. If you see the X factor is quite a lot in terms of almost 45 degrees to 50 degrees, whereas here in novice athletes, they can produce only 20 degrees of X factor. That means 20 degrees of trunk rotation. That's why, you know, experienced players, they can generate a lot of force by using the X factor, by using the trunk rotation, because trunk is the core which actually transmits the energy from the lower limb to the upper limb. So the remaining 87%, yes, trunk should play a major role in transferring the force, isn't it? For any badminton smash, volleyball spike, or a tennis serve, whatever it is, whatever overhead sport it is the core, the center, which actually helps in transmitting the force from the lower limb, which is generated through the by exerting a force on the ground, and then ground in turn exert a ground reaction force. So thus it gets transmitted through the trunk and to the shoulder, for which you need a good X factor. That means good trunk rotation. Okay, so how that trunk rotation helps, how that X factor helps, if you see, I will just give a metaphor. If you want to make this fly, make the propeller fly, you can't exert a force from here, isn't it? You have to roll it like this. You have to exert a force from here. So if you rotate like this, probably the propeller will run. Oh, how is it possible? Now, is it possible for you to, you know, propel the propeller by delivering a force here? It is impossible, isn't it? So what makes this happen? So when you deliver a rotational force from here, the entire force gets multiplied by almost 32 times. So that makes the propeller fly because of the momentum. Look at the momentum here, 4 inches, and this has a momentum. So it gets multiplied. The force gets multiplied almost 32 times when you want to, you know, fly a propeller. The same thing you can apply, for example, whether it is a tennis serve or a golf. Like, and if you can keep like this, if you keep your body like this, so this is the trunk, and this is similar to the propeller wings. So if you are generating a force from your abdomen, okay, so that means you are able to generate, you can multiply a lot of force. For example, in golf, if you see, if you generate good torque from here, abdominal torque, if your X factor is good, it gets multiplied by almost 75 times, and totally, so it gets multiplied by 75, which is the momentum, and totally it gets multiplied by 25 times. So the force which generated here, it gets multiplied by 25 times. So that is why you experienced athletes who have a good X factor, they have a greater efficiency in producing maximum torque to the implement, whatever they use, whatever sport they are in. Okay, so one example is, so proper coordinated throwing motion. If you see, you can see this. First, initially the lower limb, there was a movement, that's the first sequence, and then it is followed by your pelvic movement, and then it is followed by your trunk movement, and then it is followed by your shoulder movement. So there should be a sequence of movement which has to happen from the distal to the proximal extremity. So this sequence is important. So not only X factor is important, the X factor, yes, it is important, but how you are sequencing the X factor is important. Imagine if you are sequencing the X factor, like your X factor, that means your trunk rotation and your pelvic rotation and your leg movement, everything happens simultaneously. Do you think you will be able to transfer the energy? No, it is not possible. So it has to be transmitted properly, so it has to be followed in a particular sequence. So the first part is the lower limb movement, then the pelvis should move. So that force will be transferred by your core muscles to the shoulder. Finally, that force is getting transmitted to the implement, whatever you're using, whether it is a javelin throw or a pitching or whatever, or even a tennis serve. So there should be a sequence. So one study which they have done the importance of trunk rotation sequence with the maximum external rotation angle and the shoulder joint force in high school baseball players. So what they have found is baseball pitchers who demonstrated improper sequence, as I have said, if the sequence is not, if your X factor sequence is not following your pelvis movement, what happens is you tend to exert a lot of force on the shoulder. Then if your sequence is proper, so if your sequence is proper, efficiency is good, so you tend to transfer proper force. So shoulder will get a maximum energy from the lower limb as well as the trunk. So when the sequence is not there, what happens? Still you try to deliver a lot of force from your shoulder, isn't it? So what you do is, so here your kinetic chain is not proper, so you tend to deliver the same force, but still you have to do that activity, right? You have to do the same force. So a lot of force generated from the shoulder. So in course of time, what happens is repeated overuse force and excessive force will be transmitted to the shoulder. So especially whenever you generate a lot of force and then doing a deceleration phase, a lot of energy is created, and during deceleration phase, all the energy has to be absorbed, isn't it? That's where your lot of micro trauma will occur to the posterior capsular structure as well as the muscles which has attachment to them. That is why most of the time when you involve in repeated activities and when your kinetic chain is not working properly, you deliver a lot of force from the shoulder, try to exert a lot of force from the shoulder, a lot of micro trauma, repeated micro trauma, and it heals and it forms adhesion, right? Whenever micro trauma happens, it heals, and it forms, whenever it heals, it forms an adhesion. And that is what the reason for the restricted internal rotation motion. So the posterior capsule gets stiffer, so that will restrict your internal rotation range of motion, and your muscles which has attachment to the posterior capsule, especially the infraspinatus in the teres minor, will have a lot of tension, and that also will go for tightness. So all these issues are happening because of the lack of proper sequencing. So if you have a good sequence, that is going to help you in order to exert more force on the shoulder, because you're adding up with the shoulder force so that your efficiency is maximum. So kinetic chain activations, what actually works and how it works. So if you see the anatomical connections, if you see, yes, everything is pre-programmed in the brain. How it has to activate. But anatomically, if you see how these muscles are acting, simultaneously as well as in a sequence, how these muscles are acting in a sequence, that means their arrangement anatomically also has to be important, isn't it? So if you dwell deep into the anatomical orientation of the muscle fibers of these kinetic chain activity, especially overhead activity, probably we'll be able to address some of the concept. So this is the adductors of the lower limb. So we are trying to connect the adductors, trunk, and the shoulder. Okay, so this is the adductors of the thigh. So look at the muscle orientation. Most of the orientation will be this way. Okay, so that's the adductor. The muscle orientation will be similar to this. Okay, so next is coming to the, now I'm trying to link the lower limb with the anatomical link between the lower limb and the abdominals, especially the external oblique now. So the external oblique orientation, if you see, look at that. There are, see that it interdigitates with the serratus anterior above. It has a lot of connections from the ribs, as you have seen, and most of the orientation will be like this. So this is oriented this way, and this is oriented this way. So this has a similar orientation. Your external oblique has a similar orientation, that is the opposite side. Okay, for example, this is the right side external oblique, and the left side adductors have a similar muscle fiber orientation. Okay, so we can say when it acts by the neural control system, it has a similar muscle orientation, so they can act together, or in sequence, we should say. Okay, so now this is external oblique. You know that external oblique orientation is this way, and your adductor orientation is this way. So somewhat similar angle of orientation of the muscle fibers. Now we look at this internal oblique. So internal oblique orientation is this position, this way. Okay, so for example, this side, so right side external oblique and left side internal oblique, almost like this. So that has a similar orientation. That is, the opposite side external and the internal oblique has similar orientation, as well as the opposite side adductors and external oblique has similar orientation. Okay, so now, for example, if you do a trunk curl, when you do a trunk curl, some people they tend to do a trunk curl and then they twist it, isn't it? So when you twist it, what happens is, for example, I'm doing a trunk curl and then twisting to the left side. External oblique of my right side and the internal oblique of my left side acts together. That's what we say, right? Trunk curl with rotation. So, for example, left side rotation, my external oblique of the right side and internal oblique of the left side works simultaneously to produce a trunk curl with rotation. So if this orientation is similar, so that facilitates the orientation, that facilitates the muscle contraction simultaneously. So internal oblique is oriented this way and the external oblique is oriented this way. That forms a connection, and the adductors are oriented this way. So that has a similar orientation as that of the abdomen. Okay, so for example, if you see this picture, you can see, so there is a link between the internal and external oblique. And if you see this picture, look at that, how it acts. So that's why a lot of rotation related sport or overhead sport involve a lot of rotation related activity, which will actually facilitate this movement neurally as well. Okay. Next is again external oblique. Now, if you see that I said external oblique is connected to the ribs like this, you know that the serratus anterior also has connection to the ribs. So we say there is a myofascial connection, I would say, between the external oblique and the serratus anterior. So they act simultaneously. Okay, so external oblique and the serratus anterior work together. Okay, see here, look at that, how external serratus anterior interdigitates with the external oblique, and it has a similar orientation. So serratus anterior, external oblique, almost similar, isn't it? Similar orientation. Okay, so if you go further, now serratus doesn't stop there. There is a myofascial connection. You know that it gets attached to the inner border of the scapula. Serratus, it gets attached to the inner border of the scapula. So if you think about any muscle which has attachment to the inner border of the scapula posteriorly, it's nothing but your rhomboids. Look at that, rhomboids. Okay. So now rhomboids. Look at the orientation. Rhomboids is oriented like this. So this is oriented, and then next it gets connected to the splenius capitis of the opposite side, which has a similar orientation. So that's how head, neck, scapula, trunk to the lower limb is oriented. I mean, it forms a series of chains of muscles. So as I said, there is a connection between the external oblique and the rhomboids. Okay, so this forms a rhomboserratus complex, which is very important. We always think rhomboid and serratus separately, but actually there is a thick myofascial connection between the rhomboid and the serratus anterior that forms a rhomboserratus complex. So as I said, after rhomboids, it goes to the opposite side, that is the splenius capitis of the other side, and then it connects the neck with the head. Thus it forms one link. Look at that. So your serratus anterior, your rhomboids, look at the fiber orientation, almost similar fiber orientation, and then that gets attached to the splenius capitis muscles. And again, it comes a little forward because splenius capitis, sternocleidomastoid is there in front. Sternocleidomastoid is connected to the pectorals. Pectorals has connection here, and the pectoral fascia gets connected, and then a part of the pectoral has attachment to the rectus sheath. So anteriorly also it is connected. Also, if you see, there is a link between the gluteus maximus and the latissimus dorsi of the opposite side. So look at the fiber orientation of the glutes max. It is like this, and if you see the opposite side of latissimus dorsi, for example, this is the right side glutes max. If you see the latissimus of the opposite side, it will be exactly in a similar fiber orientation. So these anatomical fiber orientation, okay, it makes it simple for a rotation related sport activity to act, so that the neural system can control this movement and it provides a rotation related movement. So that's how the kinetic chain works. So just a small recap. So adductors of this side, for example, left side, it has connection to the, say it has a similar, rather than connection, I would say it has a similar fiber orientation as the external oblique. External oblique of one side has a similar fiber orientation of the internal oblique of the other side. And external oblique doesn't stop there, you know, it interdigitates with the serratus anterior. It interdigitates with the serratus anterior, and then see like this. And then the serratus anterior is not, it doesn't stop exactly on the medial border of the scapula. It forms a myofascial connection with the rhomboids, and rhomboids again, it has a myofascial connection with the splenius capitis of the other side. So thus it forms something called as a serape muscles. We say it forms a spiral, it spirals around, isn't it? So like this. Spirals like this. So this is called as the anterior spiral. Okay, and posterior spiral, you know that there is a link between the glutes max and the latissimus dorsi of the opposite side. That forms a posterior spiral. So thus the anterior and the posterior spirals are formed. We say the oblique chains are formed. So like this. So lats fiber orientation, which has a similar fiber orientation as of the glutes max. So this will act simultaneously, and lats of the right side and the glutes of the left side acts in unison. Okay, and anteriorly, if you see, serratus anterior external oblique can act with internal oblique, also with the adductor. So that's what the post transmission happens. Okay. You see the picture. Now try to apply the same principle, all these connections, anatomical connections, and then try to apply on the overhead sport javelin throw. So let's discuss here. So adductors are active. Now in this case, what happens is there is a stretch here, complete stretch. So okay, so anterior oblique line is stretched completely. So he creates a quick stretch of the anterior oblique line. Now after that, okay, there are arm lines too. So after stretching that, so he is exerting a force like a stretch shortening cycle. Now the posterior oblique chains are shortened, anterior oblique lines are lengthened. Now what happens is completely he is activating the anterior oblique line. So he stretched it prior, okay, and then he is activating the anterior oblique line. Okay, so now it becomes shorter and the posterior oblique line becomes lengthened. So that's how it works, like a stretch shortening cycle, and it works along with the adductors, obliques, external oblique, internal oblique, serratus anterior, rhomboids, and then even there are neck movements, right? So thus lower limb muscular force is getting transmitted to the shoulder through the trunk. So trunk X factor is the most important aspect in terms of kinetic chain activation. Okay, what happens is, yeah, this is what happens whenever there is an imbalance. So this is what happens. There should be a right balance in all this, isn't it? The adductor should be flexible enough, strong enough, and the core muscles should be strong enough, and they should be able to deliver a lot of force, and there should be a good range, and you should have a good shoulder scapulothoracic stability, and you should have a good mobility of the shoulder, so that everything works in a sequence and in a particular range, so that you know your movement will be perfect, so that there is a less chance for injury. But as usual, whenever there is a positivity about something, there is also some studies which says that there is no relationship between trunk rotation mobility and upper quarter dynamic stability that is measured with the help of Y balance upper quarter test. They say that there is no relation between the trunk rotational mobility and the pitching velocity. But one problem in this is, like, they have tested in a static situation, like the trunk rotation range of motion they have measured. So probably what they could have done is trunk rotation range of motion, or the X factor they could have measured using a 3D analysis. So with that we could have got little more input from that. So probably because of that, this study shows that there is no relationship between rotational mobility as well as the pitching velocity, because not only the rotational mobility is important, how exactly your sequencing is important, as we have seen in previous studies, and how you are able to deliver that force is important, how strong your core is, that is important, so that the force can be delivered. So only this. Only with in terms of rotational mobility of the trunk, we can't say completely that it may not have an impact on the pitching velocity, because it is assessed this way. Okay, but there are a few other studies which shows that For example, excuse me, there is a systematic review which shows that the impact of lumbopelvic control on overhead performance and shoulder injury in overhead athletes. They say that lumbopelvic region is considered important in all functional tasks, thus providing dynamic stability to the distal extremity, whether it is lower limb or the upper limb. Lumbopelvic control is more important. For example, lower limb, if you say, to give an example, people who tend to have a weak core on the glutes medius and the external rotators of the hip, if they have a weakness, they tend to go for a dynamic knee valgus. Okay, so for example, if you have a weak core, if you don't have a good control of the core and the hip, you tend to go for example, when you're landing after a basketball jump, when you're landing, you tend to go like this, isn't it? So there may be a dynamic knee valgus. We say this is a dynamic knee valgus. So dynamic knee valgus, excessive valgus at the knee, especially during movement, that is called as dynamic knee valgus. Is when you have that, you're more prone for non-contact ACL injury. So thus hip core stability and the hip stability is important for your lower limb as well. Not only for the upper limb, for the lower limb as well. So the center part, the core, is the most important part, which actually decides how, for example, they say center stability for distal mobility. Okay, so distal is even the lower extremity and upper extremity. For that, the core should be proper. The center part, the trunk should be proper. And they say improved lumbopelvic control. It relates to improved athletic performance and decreased shoulder injury. That's what the review says. But again, need a high quality research in order to support these findings. According to the review, yes, it is. They have concluded like that, but still they have said that they need a high quality research in order to support these findings. And also we need to establish certain standard measure for lumbopelvic control, how to measure that and all those. And we have to come up with few measures, and this was done recently. So 2019 August at the year, 2019 August. So definitely there are a lot of scope to work on this area, and also to determine the preventative factors for injury and pain in terms of lumbopelvic control. So still, a lot of researches has to be done in the future. So now, so what we understood is there is an issue. Yes, core is important. You have realized. But whenever someone comes to you, an athlete comes to you, you always have the dilemma of when to ask him to go get back, isn't it? So we are a little always scared, because recurrent should not come. Otherwise, it'll be a problem. Recurrent injuries, recurrent pain, shoulder pain. If it comes, it's going to be a tough time. So there are certain return to sport battery test batteries which we usually use, and there are also some outcome measures we follow. Functional assessment tool for the upper extremity. We use quick dash score, disability index. Then we use this also, and recently they have said that this is closely related to the it is quite reliable as well, reliable and valid, and it is mainly used for people who involve in overhead sport. That is called Kerlan-Jobe Orthopedic Clinical Shoulder and Elbow Score. Probably you can have a look at it. It's quite simple, a person can fill it, and a lot of translations have been done, and they check the validity. It seems to be good. Even in Korean and Italian and so many languages they have done, Norwegian, and it seems to be good. So that tool can be used. That is Kerlan Jobe Orthopedic Clinical Test for the shoulder and elbow as well. Okay, so but functionally what we do? Okay, so other than that, other than the patient reported outcome measures, we also use functional performance test in order to decide when to send that athlete, back to sport, return to sport activity in athlete with shoulder issues. So there are certain functional tests. So again, this is the recent article where they say we used a lot of functional tests. For example, starting position here. So you start from this position, then completely extend the elbow, then you can get back. These are open kinetic chain test. So functional performance test has open kinetic chain test as well as closed kinetic chain test in order to check the shoulder. So yeah, so you will start from here and then extend, and then again you take it up and then you come back. Check whether any discomfort or pain is there. If no, then you can proceed to the other one. And there is something called as a drop catch. You have to hold a tennis ball and then you have to drop it and then catch it. So basically to facilitate the rotation movement and then check whether any discomfort or pain is there. Then there is ball taps. You have to tap the ball, tap the Swiss ball over the wall and then check any discomfort or anything is there. And then you have to do a overhead snatch start position. So all these open kinetic chain test is important in order to check whether the athlete can return to sport. Not enough. We also have to perform certain closed kinetic chain functional performance tests. For example, push-up, clap, and there is a hop start position and hop tests are there for the upper extremity, for the upper quarter. Then there are side hold rotation, that is side plank and associated with the rotation movement, and closed kinetic chain upper extremity stability test. So we say CKUEST, closed kinetic chain upper extremity stability test. So now if you look at this, probably we can play some video and then see exactly what are we assessing. Okay, yes, in open kinetic chain, yes, we are focusing more on the shoulder, but our assessment in closed kinetic chain, we are focusing on one by one. We can see. So you say, probably you can think exactly what are we assessing. Are we assessing only the shoulder? For example, a push-up clap. And this one, that is go to the side plank position and then you rotate it. Again, are we assessing only the shoulder on the left side or something else? And then again, this, as I said, closed kinetic chain upper extremity stability test, which is considered as one of the important tests in terms of return to sport after shoulder injury, where almost 35 inches we take and then ask the person to touch the opposite side 15 times and then check how far he is able to do and how fast he is able to do. So 15 repetitions, then probably can ask him. So we will clear them to return to sport only when they are able to do this, especially the close, only when they are able to do the push-up clap and without any symptoms, only when they are able to do a side plank trunk rotation and closed kinetic chain upper extremity test. So when they're able to clear all these without any symptoms, then we tell yes, you are ready for return to sport. But the problem here is, are we testing only the shoulder? No. But what are we training? We are training only the shoulder. We train probably scapulothoracic stabilization and trying to reduce the, trying to improve the flexibility of the shoulder alone, trying to improve the glenohumeral internal, you try to address the glenohumeral internal rotation deficit. But actually our test and our treatment completely, it doesn't correlate, isn't it? So for example, in push-up, if you see a lot of muscle activity, there will be some activity of even your quads, little bit rectus especially, and lot of activity of your core, a lot of abdominal isometric contraction of your abdominal muscles, not only the shoulder. So you are assessing the entire kinetic chain. And look at this now. So side plank, yes, it actually you are testing here. What actually you are testing here? Not only the shoulder, you are testing your ability of isometric, hold of your complete lateral chain of muscles, especially the abductors and quadratus and everything. So here, even the lateral chain, we say the lateral chain of muscles, the entire lateral chain is being challenged here. So you're not only testing the shoulders, right? Plus now you're rotating it. So look at that, rotating it. So your rotatory component is also challenged here. So again, you're not only testing the shoulder. And now if you see here, again, the entire kinetic chain, anterior kinetic chain is tested, right? For example, all the entire core is activated. So not only the shoulder, isn't it? So our testing actually involves the assessment of the entire kinetic chain, but our training, we are incorporating only the shoulder training for the shoulder pain or to improve the flexibility or to improve the strength, or to improve the neural control, whatever, say neuromuscular control. So there is a lack of an association between our testing and training. So what we are supposed to do is, when we are clearing that, okay, I'll include few other two. There is an upper extremity stability test. Okay, so this is called as a Y balance test, where you have to hold both the dominant and the non-dominant arm will be tested here. So you have to push the measure to the other side and on all the three sides. Okay. So that will check the upper extremity stability test of your left shoulder, as well as then again the opposite side you have to come and then do it. And then next is your hop test, where almost 10 centimeter length is there and you have to do a hop on both sides, and all these tests you have to clear in order to So that's how it is done. Right balance.
Prabu sir, everything is okay?
Yeah, you can see now, sir.
Yeah, I can see.
Yeah. Okay, so look at the challenge what we're giving. Again, in this also, the challenge is not only to the shoulder, it is on the entire kinetic chain, especially the core musculature. And this also you need tremendous amount of strength to be needed, plus you need a tremendous amount of strength of the core musculature, abdominal musculature also. Okay, so we have to clear all these tests in order to say that you are perfect, you can return to sport. So for example, some reliability study, if you see reliability of the closed kinetic chain upper extremity test, it presents excellent reliability. However, there are some systematic error between the measurements, so we have to perform at least 3 tests and take an average and for a better reliable data. And one-half test, for example, it may be a reliable test for upper extremity functional performance test, but sufficient training is required. And one more value, this is the reference values for the upper extremity functional performance test. This is the Y balance test, and this is the closed kinetic chain upper extremity test. Okay, so these are the reference values based on the age. Okay, and overall, if you see generally the reliability of shoulder arm return to test battery, most of the test batteries are reliable, so they can be used by clinicians to guide return to sport. But further examination of the test in sport specific population is required. So still we are not very clear with exactly for which sport what kind of measures are important, which are reliable and valid, which is not there. So relationship between clinical test, strength and power, and neuromuscular control are required. So still there is a big scope, and when this has been published in 2019, so still it is a lot of scope for improvement in deciding these tests. And all these tests, as I said, kinetic chain is important. They actually test the entire kinetic chain system, not only the shoulder. So what we have to try is we have to focus on improving the training based on the kinetic chain system rather than focusing only on the shoulder. So for example, a recent systematic review which studied they have done a review on the studies which have done on the EMG activity of the role of kinetic chain in shoulder rehabilitation, whether incorporating trunk and lower limb into shoulder exercises. So how many of us we do? Very few of us actually incorporate functional movement or sport specific movement, incorporating shoulder and the limb movements, especially before return to sport. Very few of us use, but it is important because most of our tests, as we have seen, it is testing the entire human movement system, not only the shoulder. So our training should focus on training the entire kinetic chain system, even the person comes to you with a shoulder issue. So these studies, this systematic review has shown this result. So they have compared the kinetic chain and non-kinetic chain exercises, where they incorporate kinetic chain exercises, they incorporate your trunk activity, or they incorporate your lower limb activity and everything, so that they can train the entire kinetic chain system. So ND is no difference. Okay, so here no difference in the activation of middle trapezius. In the lower trapezius, upper trapezius, kinetic chain exercises, let's see, lower trapezius, upper trapezius, whole trapezius, serratus anterior, okay, and posterior deltoid, not even posterior deltoid, okay, these, especially lower trapezius, whole trapezius, and the serratus anterior, kinetic chain is better. And in middle deltoid and anterior deltoid, not much of difference. And again, in oblique muscles, which we consider the most important aspect in terms of overhead sport, kinetic chain is best. In external oblique, glutes maximus, kinetic chain is better to facilitate contralateral glutes maximus, ipsilateral glutes maximus, as well as the adductors. So based on this review, what they say is definitely kinetic chain exercises which focusing on incorporating your trunk movements and the lower limb movements are able to exert a lot of force to the shoulder, able to transmit a lot of force, So they claim that kinetic chain exercises may be better than open kinetic chain training focusing only on the shoulder. But still, there are a few other EMG activations can be done with few other muscles should have been done in order to get a better understanding, because there is only one study which actually studied the external oblique, internal oblique, and the glutes maximum. So based on that, they have they described the kinetic chain. So still further, what the need of the hour is to do a lot of EMG studies on a lot of muscles, as we know the connections and how they act during throwing. So all these muscles, probably we might have to study the EMG activation of all these muscles and the sequence of activation and how it acts. It would be better. So further EMG studies are important. That's what, again, further scope for a lot of research to be done on this area. So as our testing, as we have said, as our testing is basically testing our kinetic chain. So what we have to do is our training also should focus on the kinetic chain, and few reviews have said, the systematic reviews have said that kinetic chain is better to activate a lot of musculature. So what we do is we try to incorporate certain type of training in shoulder rehab, not only focusing on shoulder but also on everything. For example, this is mainly for the scapulothoracic stabilizers. Along with that, I work focusing on the deltoid musculature. And here it focuses on the retractors of the scapula. The rhomboids gets activated, trapezius gets activated. Problem is there is usually a problem with the lower trapezius activation, and because of this, there is an excessive activation of your upper trapezius called synergistic dominance. So make sure that you don't overactivate the already activated, already overactive upper trapezius. Make sure that you do it properly. So these are the muscles. These are the training which focuses more on the scapulothoracic stability. So we say it is a TVWL exercises focusing on scapulothoracic stability. So use as less as weight as possible. The moment you try to lift more weights, then what happens is a lot of other musculature, the bigger musculature will take over, and you won't get the actual muscle activation of the deeper musculature which provides stability, the core stabilizers of the shoulder and scapulothoracic joint. So as light as possible. So focus on the quality of movement rather than the quantity of movement. Okay. So these are the L, which activates different musculature. So I said T, V, W exercises. One is in T shape, V shape, L shape, and then W. So these will be able to activate different musculature and make it stronger. Once you do that, you try to incorporate few other training which actually resembles your test, so that you'll be able to activate the entire kinetic chain system. So for example, a push-up on a medicine ball will activate more of your abdominal muscles. The challenge is more, so automatically the contraction of your abdominal muscles is more, and then you can even incorporate some shoulder, some trunk rotation with the push-ups, so that your core muscles along with the rotatory muscles, especially the obliques, will work properly. You're able to activate it properly. So you're trying to address or incorporate even the trunk rotation in a normal training procedure. And then try to incorporate this here. For example, if you do this, you are already rotating it. So for example, here the internal oblique of this side and the external oblique of this side works. And then you take it, your glutes max is working, your rectus spinae, and then with that your shoulder musculature is also working. Okay. So look at that, you're trying to address most of the musculature. So posterior chain is working, spiral chain is working, your shoulder musculature are working, and there is a lot of challenge on the shoulder muscle, right? So look at that. So now with the weight, now you are challenging a little more. So activating glutes, activating your obliques, activating your shoulder musculature, scapulothoracic stability, everything, isn't it? So you are trying to incorporate your kinetic chain system training in shoulder rehab. And the other ways of training it, they say windmill. So now you are activating the shoulder. Now with that you do it. So some kind of anterior spiral activation is there. Along with that, you are working on the scapulothoracic stability also, as well as the shoulder musculature. So that's the way to do it. So shoulder is getting activated here, and it puts a lot of stress, a lot of challenges there on the shoulder. Okay, so this works on the entire kinetic chain system. And there is Turkish pull exercises, or we say Turkish get-up exercises. So if you see this, analyze this movement, there is one by one movement, everything gets activated. So Turkish get up. So now the glutes is active. For example, from the beginning, if you see. So now the shoulders are active, quite active in the second stage. Plus, since you're rotating to the left side, your external oblique of one side, internal oblique of the other side acts. Now again, shoulder is challenged. Now glutes is challenged. The entire posterior chain of the lower limb musculature is challenged. Now your hip is challenged a little bit. Along with that, the shoulder is completely challenged throughout the movement, isn't it? Even the weight bearing as well as the one which you are holding the dumbbell. Now you're getting back to the same position. Now even so the glutes medius, look at that. I really struggle because the glutes medius, it challenges the glutes medius, which is one of the important aspect, as we have seen in a previous study, that lumbopelvic stability is important for the shoulder. So that gets activated. Again, now this spiral chain is a little active, your shoulder muscles are active, glutes is active now, the entire posterior chain is active now. Now again, this shoulder as well as this shoulder is active, finally getting back to the same position. So eccentrically also you're training. Okay, so probably in detail, in this angle, probably you'll get a better view of this shoulder, oblique muscles. Look at the challenge, amount of challenge on the shoulder. Okay, still shoulder is active throughout. Now posterior chain is active here. Look at that. Now glutes medius is active because you are into the split stance position. Now again, the glutes max is active, the max in there. Throughout all procedure, your shoulder is completely active because you have to hold this. It's quite difficult to do this movement. So basically, you're trying to incorporate the entire kinetic chain system into your training, the shoulder. So if, for example, in Turkish get up, you will get maximum shoulder activation is there always, but maximum in the second stage as well as the final stage, there is a maximum activation of the shoulder. And is there any other ways? Yes. So here in this, you can activate the glutes max of the left side and the latissimus dorsi of the opposite side. See that? So I'm trying to extend the hip as well as extend the shoulder. So this is the way to do it. So that you can activate the posterior oblique chain. And then again here I'm making making it a little unstable and then trying to activate the shoulder musculature. And TRX again gives a suspension system, gives a lot of muscle activation. One more example is this, where you challenge the adductors of the side and then the obliques of the other side. Plus your glutes medius is also challenged. So everything is challenged here. So basically you're incorporating the entire kinetic system. So once you incorporate, once you know exactly how it activates, probably you need to create some of the power training into that, which will activate the entire kinetic chain system. So the need of the hour is a lot of research, isn't it? A lot of research is required. Future research is required in order to find out the efficacy of your lumbopelvic control and efficacy of all these tests, whether it is reliable and based on sports specific tests are important, which incorporate the kinetic chain studies, and a lot of EMG studies are required exactly how exactly all these muscles are working. Because there is only one study which you have seen, they have used a few EMGs of different musculature, but a lot of research has to come, and still it is unclear exactly. We can't say 100% we are clear. Okay, these are the tests and these are the training which you have to import. A lot of research has to be done based on sport specific skills, and yeah, so we need to focus on kinetic chain, which is considered important. Again, in kinetic chain, we have to do a lot of further studies in order to prove exactly how it works. Anatomically, there are a few studies which shows that there is a connection, but how neurally, to train all these, whether rotation related sport, in any of the rotation related sport, how it acts and everything, we need to focus. That's all I have to say. Probably if you have anything to add up, or if you have any doubts, please you can go ahead. Thank you very much for your patience listening.
Thank you, sir. And as we wait for the question and
sure, sir.
So in case of shoulder injury, what should be the initial exercise preference, whether isometrics or resistant exercise in sports person?
I couldn't see the questions. Okay, sir, can you please?
So I'll read it. Sir, in case of shoulder injury, what should be the initial exercise preferences, whether isometrics or assisted exercise in sports person? Can you able to hear me? So Prabhu sir, can you able to hear me? So Prabhu sir, you're audible.
Hello.
Yeah, sir. Are you?
Yeah, can you
live?
hear me?
Yeah, I can
Yeah.
hear you, sir.
Yeah. Some internet issues. Yeah.
Okay, sir.
Yes, sir. Please go ahead, sir.
The first question, sir, in case of shoulder injury, what should be the initial exercise preferences, whether isometrics or resistant exercise in sports person?
Okay, so yeah, initially it depends on the injury and the level of injury also. So what we have to focus is you try to get rid of the pain and then work on improving the flexibility. For example, try to improve the mobility of that, and then you start slowly, incorporating some of the isometric exercises to train, because sometimes what they say is, for example, I would say glutes amnesia. They say that means they don't know exactly how to activate the glutes. For example, a person who can even do a deadlift, or who can do even a squat of almost 150 kgs, if you see his glutes is completely atrophied because he doesn't know exactly how to activate that. That's called as glutes amnesia. So in such cases, what we do is we have to isolately train the glutes, make him understand, try to get some motor engram ingrained in the brain. He will facilitate, he will activate his glutes and then try to learn exactly how to activate. And then finally you incorporate into that. The same way here, for example, in the shoulder, the lower trapezius is the one which gets inhibited whenever there is an injury to the shoulder. So what we do is within 24 hours, they say there is a reduction in the force output in the lower trapezius as soon as you get injury. So what they say is you try to facilitate the contraction, try to activate it. In such cases, you try to get some isometric contraction. Once you feel that yes, he is able to produce, then slowly go into resistance trainings. And then at last, once everything is ready, again, don't leave him directly, because you have to incorporate all your kinetic chain training, because he's off the training and he's taking rest, right? So incorporating the entire kinetic chain, how exactly to activate that, incorporating it is important.
Thank you, sir. Next question, is there any basic physical protocol to be followed by the sports persons irrespective of their game?
Basic protocol, as I said, focus on the shoulder, and it depends on sport specific. For example, one of a person who was coming to me, I will give an example, who was having a lot of, I should say, there is a restriction in the glenohumeral internal rotation deficit, and he feels a little bit of instability in the shoulder when he throws. He had a old injury, and, MRI was taken, and it showed nothing actually. But the kind of instability, what he felt, it was there forever. I mean, for almost 3-4 years, and whatever training he does, it is not going. It was not helping him. So again, they took a CT, and then they found that there was some lesion. Uh, Bankart, bony Bankart lesion was there, and then he had to undergo surgery. So based on the injury and based on the sports, for example, that person wouldn't have required surgery if he would have, if he doesn't want to continue his sport, but he's quite young and he wanted to continue his sport. So he had to undergo surgery in order to rehabilitate again. So after that, he feels better, and he's undergoing rehabilitation now. So based on sport and based on injury, we have to modify according to it. There is no basic protocol as such. In case if there is no injury and if he complains of some non-specific pain in the shoulder, especially while throwing, which has the symptoms of throw shoulder, in such cases, yes, you have to improve the neuromuscular control improve the stabilizers of the scapulothoracic area, improving the mobility. All those things you have to work on it. So it is definitely based. There is no set standard for every athlete to be followed. It depends on athlete to athlete, and also it depends on from sport to sport.
Thank you, sir. Next question is the pattern of muscle activity that you explained vary in cases of any physically challenged sports persons.
Definitely, yes. Even from a normal person to other person, it varies. As we have seen a big difference that badminton smash we have seen, right? There is a big difference in the X factor between the novice person and the elite athletes. So definitely there are some variations between these people. For example, if I would say, we can't completely rely on this mechanics, because if you Google, there is a person called as there is an athlete called Jep2. Probably, if you look into that, yeah, probably you can go through it. Jep2, okay. So she bagged the silver medal in London Olympics. If you see her video, Jep2's video, you will say, we will say probably we need to forget biomechanics, because he has a maximum dynamic knee valgus. She has a maximum external rotation, complete collapse of the lower limb, and she doesn't have a proper mechanics at all, but she still managed to clear, she still managed to bag silver medal. And her history, if you take, I just went through her history, if you take, there was no history of injury at all. So thus, every person is different, every athlete is different, and we can't completely rely on the mechanics of elite athletes. So you should not compare, okay, Usain Bolt's mechanics is like this, so I will try to follow his mechanics so that I can become a best sprinter in the world. It is not possible. Everyone is different. Everyone's mechanics is different. So you have to find out that and train accordingly.
Thank you, sir. Next question is there a protocol of assessment that is easily available?
Not yet. As I said, we need to work on it. The present protocol, what I have said is those closed kinetic chain and open kinetic chain assessment. But a lot of research is required. You saw that, right? Reliability only a little, not very sure about so many things, and most of it test the kinetic chain, still static kinetic chain testing, and so a lot of research has to be done. So though there is no specific format and no easy assessment for it, probably you can come up with a few assessments in the future so that you will have a set protocol and set training principles for activating this. Because I'm saying the recent study, even from 2020 studies, 2019 studies, all the reviews, systematic reviews, everything is from 2019 and 2020, which shows that there is still a big scope of research to be done in overhead athletes.
The next question is prevention is more important, and how early should it start?
Yes. Prevention is the most important aspect. Injury prevention, yeah, again, a lot of controversies are there in this. One example I'll give you. For example, if you say there should be a balance between the internal rotators and the external rotators in overhead sport. For example, internal rotators, you have pectoralis major, big muscle. You have latissimus dorsi, huge muscle. That means it has large number of muscle fibers, isn't it? So that tend to produce large amount of force. Now, there should be a balance, isn't it? External rotators, if you take your posterior fibers of deltoid, small muscle, infraspinatus, small muscles, teres minor, very small muscle. That means they have very few number of muscle fibers that can generate very less force. So most of your activities, daily activities or your sporting activities will activate more of your internal rotators. Already they are strong, and your activities and your training, most of the training, you're training the already strong muscles, which will inhibit the weak muscles, which is small muscle, that is external rotators. So what we have to focus is in injury prevention is, for an example, you have to get good external rotators training, which most of the athletes, overhead athletes, which they don't do it. So make sure that anatomically it is at a disadvantaged position because it is a small muscle. At least training have to focus more on the external rotators so that you will get a good strength of external rotators. So you will be able to observe all the force what you generate with the help of internal rotation, and then so it has to be strong enough to hold it. So for an example, this is for an example I said. So like this, mobility of your glenohumeral joint is important. As I said, keep on working on the internal rotation range of motion, because you know that when you do repeated movements, I said microtrauma will occur, and especially microtrauma will occur on the posterior capsular structures and the muscular attachments to the posterior capsule. So microtrauma, and that heals. When that heals, adhesion forms, and automatically you end up in having a restricted glenohumeral internal rotation deficit. So make sure that you maintain the mobility, maintain the muscular strength. So probably you can prevent few injuries.
So next question is the guidelines or protocols you told it's for only for professional athletes or even recreational players?
Definitely, even for recreational athletes, you can use all these tests, and then you can ask him to return to sport safely.
And there are any protocol for a number of repetitions and number of sets for the exercises?
So it depends on what you want exactly. For example, if you're focusing on muscular endurance, yeah, you have to take a lighter weight, sub-maximal weight, and then keep working on it. Probably the usual protocol, what we follow, the progressive resistance training will be of help. And then again, incorporating kinetic chain as we follow it like a progressive resistance training. Like initially, if you have seen that Turkish get up, I did it with a small dumbbell, and then I progressed with a heavier kettlebell. So you can progress like that. So it should be a progressive resistance training. And if you want to improve strength, yes, progressive resistance training. And if you want to get good control, go for lighter weights and go for maximum number of reps.
And another question is there any the role of muscle fibers, like whether it is a slow twitch or a fast twitch in force generating capacity of muscles that you have mentioned? Is there any role of that muscle fibers?
Yes. Depends on that. Yeah, as you say, type 1, yes, you can produce lesser number of fibers. Lesser production of force, and it can sustain because a lot of mitochondria is there, right? Slow oxidative fibers. Whereas fast oxidative, yes, type 2 fibers, if you have, you tend to produce maximum force. So that's the difference between the athletes. For example, a marathoner and a sprinter, if you take, this guy will have a lot of fast oxidative glycolytic fibers, where the muscle predominance is more, whereas in a marathoner, he has a lot of slow oxidative fibers, so he is more good at this sport. So especially, yeah, definitely fiber type is important in sport. That's what actually determines which sport you are good at.
So since there was a lockdown and fitness centers are closed off all around, and there was a lack of availability of the equipments to train, and also there will be a break in the workout sessions, how do we assess and initiate the training all over again?
Okay, that's a good question. Yeah, there is a lockdown. So what happens is, if you say the deconditioning will happen. For example, if you're training continuously and you leave a gap of 72 hours, yeah, it is 72 hours is enough for a deconditioning to happen, isn't it? So you tend to lose the muscle force generation capacity. You tend to lose the muscle mass. It becomes little atrophied. There are a lot of issues, and when you come back, so the return to sport after a period of rest, yes, there is a lot of issues. But if you see that adaptations of resistance training, if you're going to gym regularly, and if you see the adaptations of resistance training, most of the resistance, the initial adaptation is from the neural aspect. That means a lot of neural changes will happen that will actually increase your strength. After 3 to 4 weeks, actually it is the muscle action which you will find it hypertrophy and hyperplasia occurs, which actually increases, isn't it? So one good thing about it is you may lose the muscle strength whatever you have achieved. There are a lot of deconditioning which is happening in the muscular level, but the deconditioning is quite less which happens to the neural level. That means you are training regularly for 2 years and you take a break for 6 months because of this lockdown, and again you're going back. You don't have to start from the scratch. You have certain motor engram which is ingrained in your brain because of your old previous history of training. So normally if you take 4 weeks to get back to get some strength, here within a week, within 2 weeks probably you will get back because you have some neural engram which is ingrained in your brain which is already there. That is one good thing. Even though you lose the muscular adaptations, the neural adaptations you don't lose much, so you don't have to worry about it. So when you go back after deconditioning, you will get back faster. Thank you.
So is there any facial manipulation impact on this when the person is having returned to overhead activities after the, for example, if you have a pain or any sort of injury, and what is the literature available and based on your experience?
Yes. Okay, so facial manipulation, yeah, we have done a study where we have collected athletes, 80 athletes. Yeah, so 40 athletes were undergoing facial manipulation and these are all asymptomatic overhead athletes. Okay, so asymptomatic overhead athletes who have clinically significant JRD, we have recruited, and then we have provided facial release, basically soft tissue release based on these anatomical connections, and then we check the internal rotation range of motion. And there was a significant improvement in the internal rotation range of motion. Also, the other group, what we have done is we have just given a tennis ball release only to the posterior capsule and then stretching of that posterior capsule, that side sleeper stretch. So these are the two groups. One group received facial manipulation alone on the we say the intra and extra lines of the up arm line and the trunk line. Other group we gave focusing only on the posterior capsule and the internal rotation. Both the groups have improved significantly, but the immediate effect of facial manipulation was significantly improved than your ball release and other things. So focusing on the entire kinematic chain is important. Okay, so this we have done in asymptomatic athletes. So what we want to do is next, our future study will be, we want to focus on exactly how it works on the symptomatic athletes with shoulder issues. And regarding your literature, probably you can Google effect of facial manipulation on internal rotation or on internal rotation range of motion deficit in overhead athletes. So that's got published in Muscle Tendon and Ligament Journal. So you can just go through it once.
Okay, thank you very much. The questions are over, I think, and thank you very much for the talk.
Sorry for. Sir, sorry for interrupting. There is two more new questions. Please check the published box, sir. Muthukumar, sir.
Yeah. So returning back to sports after the lockdown, will the lockdown is be prescribed with the maintenance exercises?
I'm not audible, sir. You're not audible, sir.
So returning back to sports after the lockdown, like with the lockdown phase, be prescribed with the maintenance program or any exercise program for that the session that they lost during the lockdown phase.
Yeah, what you have to do is, as I said, it takes just 72 hours for your deconditioning to start. It would be ideal to to do a maintenance program, maintenance of your strength by using your stretch bands and therabands and therapeutic and all those. You don't have to actually need heavy weights. There is something called as a concept called accommodating resistance. Just by using a resistance band, you can accommodate resistance and make the tension as similar as that of your lifting weights. For example, you have only 15 kgs dumbbell, two dumbbells you have. With that, you can actually accommodate the resistance using stretch bands and then make it as tough as possible. So these are called as accommodating resistance principle just by using stretch bands and everything. So that you can do, and a lot of calisthenics you can do. So definitely you're not going to lose that much if you're able to maintain during the lockdown period. So then coming back is important, very easy, isn't it? Because there is less deconditioning, so you'll come back within a week or 2 weeks easy. So it won't take much drop in your muscular adaptations also.
So another question, how does the psychological factor impact on the return, and what the role of the physiotherapy in evaluation and planning?
Very good question, because yeah, psychosocial behavior is important. Major problem is with fear avoidance behavior. Okay, so that means, for example, someone has shoulder pain because throws shoulder because of repeated throwing, and what happens is, again, when you do a return to sport, asking him to throw back, he won't do it with the previous level of his performance. Definitely there will be a reduction in the performance, basically because of the fear avoidance strategies. So definitely you have to work on the cognitive aspects, his psychological aspects, to improve that, to make sure that he is strong and he is ready for everything. Definitely PT have a big role in that, and yes, it is important.
Muscle fiber type, can it change after injury?
There are studies which shows that it changes after injuries, but not in terms of shoulder injuries. I haven't come across any study which shows that there is a change in the muscle fiber type. But I have seen few studies long back about changes in the muscle fiber types after spinal cord injury. Yeah, it's a good question. Probably we can go through, is there any change? And I have come across few studies where you know about the recovery, right? There are something called as ice baths and all those things. There are few studies which says that recovery helps in changing the muscle fiber types, but I'm not sure because it is not. I'm not sure about that. I have come across, but only one study I have come across. So definitely injury and muscle fiber type changes. Probably you can go through it, as well as recovery and muscle fiber changes also you can go through it, because lack of recovery, they say muscle fiber adaptations are there and you can go through it.
I mean, no more questions, I think. Thank you very much, sir, for your thoughtful session, and you are correlated with the analysis of movement also, and how the kinetic chain is activated, how the force is generated from like the trunk and abdominal muscles and in overhead sports, and return to your demonstrating some activities, how the it will make the person to return to sport. And it's very wonderful session, and in future also we'll have a session like this in future. Thank you very much for this wonderful session, sir.
Thank you very much.
Thank you, Prabu.
Thank you, ma'am. Thank you very much, ma'am. Thank you for the opportunity. Thank you, ma'am.
Have a good weekend. Bye.
Thanks, ma'am. Thank you. Thank you, sir. Thank you, Kundan, sir.
Thank you, sir. Thank you for being here.
Thank you, sir. Thank you. Thank you. Bye, sir.